just gonna have to take your blood pressure real quick. Okay, it seems like your blood pressure is a little bit high. Have you been taking your medications?
Yes, I have been taking my medication, but I haven't been exercising or dieting the way that we discussed.
Okay, so we talked about quitting smoking. Where are we in regards to that?
I've been going through a lot in my life right now, so the nicotine patches or the gums aren't actually working.
And you went on a cruise recently?
Yeah, so I just came back 5 days ago and I've been sick ever since.
You didn't take any vaccinations before you left, did you?
No.
Okay, well, I'm just gonna need you to take a deep breath for me.
So you're saying you're frustrated with one of your patients?
Yeah, so like patients come into my clinic, they don't take my advice, and then they come back with far worse symptoms. I mean, you work in the Ministry of Health. Don't you think that's going to take a burden on our healthcare system?
Oh my gosh, I know what you mean. The costs are continually rising. If more and more patients are like this, then our healthcare is not going to be sustainable. Oh, you work on the task force for preventative healthcare. What do you see?
Well, it's not as bad as people make it out to be. We have lots of preventative measures that can help patients be healthy, and if they do get sick, we can help them so their conditions don't get worse. And it's a good idea for doctors to keep an eye out for patients who are at risk of particular disease.
I mean, consider the 5 levels of prevention. There's like primary, secondary.
I think it's primordial, primary, secondary, tertiary, and quaternary.
Yeah.
Well, a primordial prevention is to minimize the risk to health and a development of factors that poses future health risks.
Oh, like preventing smoking or establishing prenatal nutrition programs to support early
Childhood development,
Yeah.
yes.
So doesn't primordial prevention include things like wearing your seatbelt while you're driving, or like not using the phone while you're driving?
Exactly. Primary prevention is the active prevention method that tries to prevent inception of the diseases altogether. It can vary from adding fluorides to the water system to harden tooth enamels to immunize to improve resistance to viruses.
Yeah, and secondary prevention is based on early detection of diseases, which can include interventions or controlling the progression of the disease. So that can include like mammograms to do early screening of breast cancer.
What are you guys doing? You guys have been here for 2 hours.
Okay, don't you think if a patient's already diagnosed with a disease, they'd want to prevent further deterioration?
Huh?
Yeah, that's called tertiary prevention.
What just happened?
Okay, that should be everything. What's the 5th one then?
Well, did you guys know that hospital-acquired infections are one of 5 leading causes of death in Canada?
Wow, we need to take actions to prevent possible harm or adverse effects caused by health interventions, diagnostic procedures, or even medications.
Exactly. On top of that, another reason quaternary prevention is important is because prescription abuse and medical error are on the rise.
Guys, I'm so glad we have the chance to go over all these steps, and this was such a great refresher for me. From now on, when new patients come into my clinic, I'll have these preventative methods in mind so their health doesn't deteriorate and they can stay healthy.
All in this together once we